I am giving you a number which only is reported deaths at the cardiac facilities and respiratory care facilities of Pakistan. And we are missing those who suddenly died due to a heart attack, sudden death at home, and they were just witnessed by some GP or relative or some person who reported or announced that it is he or she is dead. This is not included in this data. So 47 deaths per hour means that the reported deaths mean that the actual number will be much more than this. The horrible figure is not this 47 deaths per hour. It is that 60% of these deaths are less than 60 years of age. This is a very serious figure. That out of those heart attacks, majority of these, almost half of these, are dying at a premature age. Pakistan's life expectancy is 65, 66 years. 65 years in males and 66 years in females. But the deaths, heart attack deaths, is happening in the ages of 40s and 50s. Very young, very productive, and very active people. Suddenly they got diagnosed of a cardiac, coronary artery disease or some other. So this is again has become a social problem. Why? Because most of the etiology of these non-communicable diseases, it goes the way we live in the society, the way we eat, the way we sleep, the way we move or do not move, and the way we interact and socialize with each other. Number one killer for heart disease is stress. It is the number one risk factor in Pakistan for killing the people. It's the job stress, economic stress, family stress, stress of some, future or, in school days. So we start getting stressed the day our parents put us into the schools. They gave us around 10 kilogram bag at our children's back. They carry it to the school and they come back, and everybody is interested in getting A plus and alphas and A levels or whatever, O levels or metric system. The children, they just get into the school to take stress. They are not there for innovation or creativity. Nobody talks about creativity, innovation, and healthy schooling, healthy teaching in any school of Pakistan. We used to have some private schools a long time ago. I don't want to take names. They were the one who made some of their students creative in arts and designing and planning and other things. Now, because of this craziness of becoming a doctor or an engineer or an IT expert, has put every student into a nightmare. So everybody is running after grades. Everybody is running after the numbers. It's a number game. Since you enter at 4 year of age or 3 year of age, you enter into the school. The day you get out in by after doing a BS or an MS, you are stressed. And then in the job market, there is stress. For female, the stress is even more. The females are in Pakistan are supposed to be doing all the education and all the jobs, and then they come home and they have to take care of all the home also in addition to their jobs. This is not the case in the West and any other part of the world, where the working women have more stress as compared to any other person in the country, because they have to take care of the both the situation inside domestic and outside the office jobs. Harassment is there. There is a lot of underpaid women working in this category. They are harassed, they are insulted, and it's very difficult for them to travel, and of course it's very difficult for them to work over there. So the non-communicable diseases, to mention a few, like heart disease, hypertension, stroke, cancer, diabetes, arthritis, a lot of chronic diseases like chronic bronchitis, smoking, tobacco was thrown out of USA and European countries, and the developing countries very, anxiously welcomed these big tobaccos because they were bringing in dollars, they were bringing in foreign direct investment, they were giving us taxes. So look at this billions of rupees of tax and trillions of rupees of diseases we are having through tobacco. So that is a social problem. Addiction, drinking, these issues of smoking, and I tell you that in Pakistan, majority of the addictions, they start with a cigarette. I always advocate against the tobacco use, because not just it is nicotine, but it is the entry or the way of getting into some very severe form of addiction. So the students, they start with a puff, they start with a smoke or a cigarette, maybe a menthol, and then they switch to the other topics of other brands of cigarette, and then they start having filled cigarettes with cocaine and not cocaine or any other chemical and other things which they start using, and they ultimately go to injectables and puff and snuffs and other things. So this is an issue which is a social issue. Now, I will conclude last 5 minutes, Anaya. Um, what can we do and what we have not been doing? The thing is that we have been always running after the disease. So my health system in Pakistan is a disease-based model. It's not a health system, it's a disease system. We do not call them Department of Health. I call them Department of Diseases. So if the Department of Health of the country is taking care of malaria, TB, HIV, and the programs by the name of malaria control program, TB control program, HIV program, heart disease program, hepatitis control program. So if you are running after diseases and you are not doing anything for the social aspects of the disease or public health, you cannot call yourself health department. You are basically targeting the disease and diseased persons. You are not treating, you are not actually preventing, you are treating the cases of the disease. So we have to think and rethink our mentality towards prevention, which initially the first slide which Justin showed us was all about health promotion and health protection. So no concept of health promotion and health protection is here. If you say there are preventive programs in Pakistan, I do not believe there is even a single preventive program in Pakistan. The vertical programs of Pakistan have become the curative programs of the diseases. They are not the preventive program. If you say the TB control program, they are emphasizing dots. They are emphasizing the treatment of TB, not the prevention of TB. The program of hepatitis is treating with disease, with medicines, with tablets, 3 months, 6 months course. They are not doing anything for prevention of hepatitis. Nobody is doing anything for prevention of HIV and AIDS. Everybody is interested in establishing the ART centers, the highly aggressive antiretroviral therapy. So all the preventive programs have become custodians of the big pharma. So they are providing high cost medicine at the cost of the government of Pakistan purchasing those medicine and providing to the patients. Where their role is prevention. The role of the government is public health. The curative and the treatment side can be taken up by the private sector. It's easy for the private sector to go for curative treatment side, and government can fund for the poor. So it is very straightforward that the immunization, the sanitation, the quality standards, the health planning, the disaster management, these are the roles of the government of Pakistan. The role of the government is not providing treatment or medicines to the diseased cases. It is any GP can do that, any private hospital can do that, and you can fund, you can support some of the poor patients of Pakistan through the support which is known as social health protection. So we need a social health protection program in this country. So the social health protection program in the name of giving 1,500 rupees to the women is absolutely a flawed program. How will you ensure that these 1,500 rupees are actually spent on the nutrition of that women or their children, or the health of their women and the children? Why don't you provide education and health services as a social health phenomena so that they become healthy and they become educated? Only then the effect of those rupees which you are spending in billions of rupees in the name of some political leadership, it is absolutely doing no good. We are going down and down in health system ranking of the world. Currently we are 143. The rank of Pakistan is at 143 number out of 160 countries of the world. Rwanda is better than Pakistan. Ghana is better than Pakistan. African countries have taken have taken ahead of Pakistan. Pakistan is going bit below. I think there will be Afghanistan or a few other sub-Saharan African countries who are worse in health than Pakistan. So this dialogue today, thanks to Pakistan Health Parliament and all the panelists here, I think this debate has to be taken up in the parliament, actual parliament, in various forums. I'm happy to talk to Pakistan Health Parliament, and we can go to PIPS, the Pakistan Institute of Parliamentary Services, where all the MNAs and senators, the speaker is the custodian of that house. the PIPs. So we can go there and we can talk to the committees and other things. So instead of listening to the executives and the bureaucrats who know very little about anything, and they are running the show and making the policies of the country. They should invite the relevant people of social health, public health, and society, the political people who are interested in health, the politicians. They should invite those from the communities, the community representatives, the patients, representatives of the patients of HIV and hepatitis and TB and all other diseases. So this is the dialogue. I think it should continue, and it should go further into the policy making bodies of the country, and we should be starting to do something about actual social health issues in Pakistan. Thank you very much, Anaya. Over to you.